Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in. It is that time of the morning where we try to bring you some information that'll educate you about your health. And we have one right now that if you were to ask me what celiac disease is, I would say, I don't know. I don't know. So we're going to learn a lot about celiac disease. And one of the things that I have in the information that was provided to me for this interview says this. Listen to this. 95% of celiacs don't know that they have celiac disease.
Wow.
Dr. Daniel A. Leffler is on the phone. He's the Director of Research and the Director of Quality Improvement for the Division of Gastroenterology at the Celiac Center at Beth Israel Deaconess Medical Center. Hope I said that right. And he's the Assistant Professor of Medicine at Harvard Medical School. So I think we went right to the top with this one. Getting educated on celiac disease. That's what we're doing right now. And I am no better than any of you. Many of you probably know this better than I do. Dr. Daniel A. Leffler. Good morning, Doctor.
Good morning. Great to be with you.
Okay, so the only clue I have is in your titles, gastroenterology. So this is a digestive system issue, isn't it?
Yeah, it is. Celiac disease is centered around the gastrointestinal system, the small intestine, to be exact. So to just solve that mystery about what celiac disease is, it's an immune reaction where people eat gluten protein, which is in wheat, rye, and barley, and it causes the immune system to become hyperactive and damage your body, primarily your small intestine, but other parts of the body as well.
Well, that's pretty scary. And so now gluten is a word that in my vocabulary entered maybe 4 years ago or so, and it was always associated with wheat. And before that, you would hear whole wheat bread is what you should eat. And then all of a sudden you started hearing gluten is no good for you and gluten is in wheat. So is this for everybody? I mean, is celiac disease only for those who are gluten intolerant, or help me out with that part of this?
Sure. So that's been sort of a really an interesting area that there's been a lot of public attention to in recent years. And I certainly would not want to come across with a message that a gluten-free diet is for everyone. I think the vast majority of the population do just fine with wheat and related products. They're actually very nutritious. They have a lot of B vitamins and fiber, all of which are good for us. But there is a segment of the population, not a tiny one either, about 1%, of 1 in every 100 people have celiac disease. And in these people, eating wheat and related grains causes significant problems. It damages the intestine in a very real and important way. It causes symptoms. It can cause nutrient deficiencies, even some serious long-term complications. So in that population, it really is important to get diagnosed and stay strictly gluten-free. But for the majority of everyone else, that it's perfectly okay to continue eating wheat products. Just
to understand it better, if somebody is gluten intolerant and they get celiac disease, and to correct anything I'm saying that's wrong, please, their body views gluten as almost as a bacteria, and it tries to attack it?
Yeah, sort of. That's actually not far from the truth. So I think one thing just to clarify is there's a difference between gluten intolerance or gluten sensitivity and celiac disease. And there's a portion of the population, we don't know exactly how big it is, but it's probably a few percent of people, maybe 5%, it's not entirely clear, who don't have celiac disease and don't have damage to the intestine but feel better on a gluten-free diet or a low-gluten diet. This we don't really know exactly why it is. It's probably a variety of different reasons. And those people should avoid gluten, but they really don't have celiac disease and they don't have the complications that we associate with celiac disease. In people with true celiac disease, then what you say is really true, is that the gluten stimulates an immune reaction. The immune system, as you mentioned, its main job is to fight off infections and keep us healthy. But in celiac disease, it acts like the gluten is almost like a bacteria, and it starts attacking everything around it and causing sort of widespread collateral damage, you can think of it as.
So if a person does have celiac disease and they don't know it, and they think they're eating healthy with all the right grains and everything, yet they are always continually losing weight, chances are it is celiac disease because of the malnutrition part?
Yeah, weight loss is certainly a major hint that this could be celiac disease. But only a small proportion of patients will have weight loss. Most people will have much less obvious symptoms of celiac disease. And we really suggest not just weight loss, but if you're having any symptom that's sort of odd, unexplained, even if it doesn't seem like it may be related to wheat, to go ahead and at least assess whether, with your doctor, to talk to your doctor about getting tested. The blood testing for celiac disease today is so good. It's very accurate. It's available in every doctor's office. And this is why it's really quite a shame in many ways that people go for years without getting diagnosed, if they ever get diagnosed with celiac disease, when really all they need to do is get a simple blood test and start the ball rolling.
So is it something we develop, or it sounds like it's not something we catch. Am I right?
Yeah, it's not something, right. It's not contagious in that way, and you're not born with it either, though. It's something in between. It is a hereditary disease. It does run to some extent in families, but it's not genetic in the way we think of some other genetic disorders.
So we develop it somehow.
But it develops, yeah. It just turns on, and actually, that's one of the things that is kind of mysterious that we still don't understand well, although we understand a lot. People can get it at age, at an infancy, the minute they're exposed to gluten at age 6 months, they can get it when they're 90 years old, and we've seen everything in between. So what turns it on is unclear, but there's something, probably in the environment, maybe an infection, that just suddenly turns on celiac disease in someone who is at risk because of the genes they carry.
Is this something that affects all cultures worldwide, or is it just contained in our part of the country, of the world? I'm sorry.
Sure, that's a good question. It used to be thought of as that it was really limited to children and to people of basically Western European descent. But now we know that it's actually common in almost every ethnicity. Almost anyone can get celiac disease. It's more common in certain populations. It's less common in people, of pure Southeast Asian descent is pretty unusual, pretty rare. But outside of that, it really is something that can affect almost everyone. And we have people of all ethnicities in our clinic with celiac disease.
Now, it says in my notes to prepare for this interview that gluten is found in wheat, rye, and barley. And again, I'm going to show my ignorance, but I'm going to ask anyway. Could beer trigger it?
Oh, good question.
Yeah, very much so. Beer has a significant amount of gluten in it.
Oh, really?
So, the things, the things we think about, as a major in the Western diet, in American diet, the breads, pastas, and beer really is one of the main things people ask about, and the main ways that people get, adults get gluten in America today.
Huh.
And unfortunately, all those things need to be removed once you have celiac disease.
Okay.
And you go on a gluten-free diet.
Let's talk about the statement that I used at the beginning. 95% of celiacs don't know it. Are there symptoms that, and again, this is always risky when we do this because somebody's going to say, "Oh my God, I got that symptom." So I'll ask you to do the disclaimer part here. But are there symptoms that might help us figure out whether we have it or not?
Yeah. So this is always a great question because it really presents in so many different ways. Clearly, if you have ongoing gastrointestinal symptoms, you should be tested for celiac disease. But that's only going to catch less than half of people with celiac disease. Most people don't have gastrointestinal symptoms. They have other symptoms. And, again, anything from skin rashes to hair loss to fatigue to neurologic difficulties to joint pain, all of these can manifest with celiac disease. And I wouldn't want anyone with any of these symptoms because it's almost everyone when you get that list to rush out and think they have celiac disease.
Yeah, right.
At the same time, though, again, the blood test is easy and accurate. And there's little to be lost if you're having one of those symptoms and you don't have another good answer for it. You don't know why it is. You haven't found other reason why you have joint pain. To talk to your doctor and say, hey, no one really knows why I have joint pain. I've had it for a while. Do you think it makes sense for me to get this blood test for celiac disease? And I think, and that's really very effective. And in most populations, cost effective too to do that.
Wow.
So again, so people should think about it, and they should think about whether it fits them. Not change their diet, not dramatically change the things they do, but at least think about talking to their doctor about it.
Well, I'm surprised at the symptoms, actually. I was thinking that if it's in the small intestine, that you would say diarrhea, cramps. To say skin rashes and joint pain, that almost doesn't seem like it even makes sense.
Yeah, and I think, unfortunately, I think many doctors think along the same lines, and this is why it just doesn't get diagnosed. But it's really, once, this happens not only in celiac disease, in many other immune diseases, that once you have a very active immune system, it starts making proteins and causing inflammation that can spread outside of the intestinal tract. And we know that many people people have different thresholds for feeling gastrointestinal symptoms. I'm sure people with a strong stomach and people who, just have a very sensitive stomach.
Mm-hmm.
And some people have a strong stomach and don't notice they have GI symptoms, but do notice that they have a rash, even though it is all starting in the intestine.
Oh, wow. Wow.
Are you soliciting people to be part of studies?
Yes, thank you for asking. So we do a lot of studies, actually, in celiac disease. We're very invested in this field. But one of the studies we have going on right now that's going on all over North America that we're participating in is a study looking at a new treatment for celiac disease to help with the gluten-free diet. So we know, it's easy to say, well, just avoid bread and pasta and things like that and beer. But unfortunately, that's not good enough to cause healing and
Oh, really?
improve symptoms on a gluten-free diet. It's really even a couple crumbs of bread that could fall into your salad, say at a restaurant, is enough to make people with celiac disease sick.
Oh.
So it really is a huge burden. It's a huge thing for the whole family. It's not just for the patient. So many people, if not most, have ongoing symptoms, at least occasionally, and don't get full healing of their intestine and are at risk for some of these complications. Sometimes severe infections, even some cancers are related to celiac disease if untreated. So we've been looking for a while now for other ways to treat it to make the gluten-free diet more effective.
Okay.
And this study, the Celiaction study, is one of the ways we're doing that.
Okay, so let me just reintroduce you and kind of try to sum up what we've covered so far for the listeners who just tuned in. And please, again, correct everything I'm going to say wrong here. Dr. Daniel A. Leffler, I got that right, I'm sure, is our guest. And we're talking about celiac disease and what we've learned so far. And it's an autoimmune disease, correct?
Yes.
Okay,
correct.
make sure I got that right. And it actually is centered around your small intestine, and gluten is often what triggers it, or is it always what triggers it? Is often or always?
Always what triggers it.
Always.
So to have celiac disease, it needs to be gluten triggered.
And yet, and here's the part that gets to me. Well, the two things then yet. First of all, it may not be a gastrointestinal feeling. You might get a rash or joint pain. Mm-hmm. And yet the gluten, when you remove that from your diet, it's not enough. I don't understand that. But is there anything? Is it a curable disease?
So they're all good points. So it's not curable. The only way to treat it is by staying right now on a gluten-free diet, and that's really, and unfortunately, we've made a lot of advances in the field in diagnostics and our understanding, but the therapy hasn't changed in 70 years. It's all we have to offer. So if you could remove all gluten from the diet forever, you really would have a great long-term treatment. It would probably make basically almost everyone better. But unfortunately, short of living in a bubble, there's just no way to be gluten-free. As I said, you have to be very, very strict. A couple crumbs of bread, and gluten is in everything. It's used in meats. It's in some medications and supplements as a filler. It's just in so many sneaky things that it's almost impossible, if not truly impossible, to really be 100% gluten-free in our environment.
Okay.
Can a woman who is pregnant, she doesn't know that she has celiac disease, and she has not delivered her baby yet, and then all of a sudden she's diagnosed with it, is there a chance that the baby will have it, and could she have a normal delivery?
So those are two good questions. So let's tackle the second one first, actually, the one about the normal delivery. So active untreated celiac disease is associated with a variety of adverse pregnancy outcomes. Low birth weight, C-section, miscarriage are all associated with untreated celiac disease. So if there's any population that I think really should be tested very liberally for celiac disease, it's women who are planning on having children in the near future. And, GI symptoms are not uncommon. Iron deficiency anemia is not uncommon in young women. But these are some of the same ways that celiac disease can present. So that's the population that I myself am most concerned about because, these are really things that can affect pregnancy in severe ways. That being said, most people can carry the pregnancy through without a problem. But celiac disease is hereditary, and it's not whether or not the mother is following a gluten-free diet or not, but it's sort of the genes and other things that the child will have from a parent with celiac disease. And so the risk of having celiac disease in a child whose parent has celiac disease is about 10%. So it's about 10 times higher than the general population. So still 90% of people with a family member with celiac disease won't get it, but a significantly high percentage will, and we really should be very aggressive about testing people with a family history for celiac disease to see if they may have it.
Let's say somebody's listening right now. They've got a rash, they've got a joint pain, and some of the symptoms you mentioned earlier they have, and they say, I've had this for years. I just keep putting lotion on the rash. I just keep, this and that. Are they actually a time bomb, or is it going to get worse for them?
So it can, and it's unpredictable. Like many medical conditions, you can live fine with it for many years until something happens. And in many people, it won't happen, but in some people, it does, and it's very unpredictable. And the only thing we can do to prevent that and to lower the risk of those complications is to treat it. So, I think many people will say, well, I think that's, common. People don't want to change their diet in these type of ways.
Right.
It's really hard. And they say, well, I've been living with this for ages. Why should I go and seek treatment now?
Yeah.
And really it's because you don't know what's going to happen in the future. And we don't know for any specific person. But all we do know is, in very real terms, is that if you have these symptoms and you have untreated celiac disease, you're at risk for some bad things that you really do want to take seriously.
So how is it treated? I'm still in the dark about this. It's getting away from gluten is obviously one thing you would want to do, but you suggest that that's not enough. Is there a medicine that goes along with this? What should we do?
Right. So right now there's nothing else, unfortunately. So I think that right now all you can do is go on a strict gluten-free diet. You should have you should see a dietitian, follow up with a patient support group to help get on a gluten-free diet, and all those things can be very helpful. And in many people it's all we have to offer anyways, but in many people that is actually good. But it is very burdensome. So even in people who that's effective for, it's still a really difficult treatment that could be easier if we had a treatment to help it out, to make it not need to be quite as strict. On the other hand, there's many people for whom even that is not effective. And we really do need something better. And that's really what we're working on. That's what we're talking about here with the Celiac Action Study is, can we find a medicine that can that cannot replace the gluten-free diet, but will make the gluten-free diet easier and more effective. And I think having one of those things will really improve people's quality of life in really dramatic ways.
Now, we have had some tragedies within our high schools in the state of Florida, and there have been some in other states where the young students have been playing football, they've been out there exercising, and all of a sudden they just fall down and they die. Do you think that they had celiac disease and they didn't know it? Do you think that might have been one of the contributors?
So that's hard to say. I would guess that probably not. I mean, that sort of arrhythmia type of death is not really associated, although certain cardiac complications are associated with celiac disease. They're mostly really in older people who have had this for many years. I think those tragic cases are probably due to other cardiac heart issues.
Mm-hmm.
The information on my notes say that, and you mentioned this already, undiagnosed and untreated celiac disease can lead to the development of malnutrition, osteoporosis, infertility, neurological conditions, and in rare cases cancer, and some of the other things that were mentioned earlier, like the rashes and the joint pains. And for those who are suddenly becoming paranoid and thinking, "Oh my goodness, I have some of those things," what do they do? I mean, do they go to their doctor and they say, "I heard this interview about celiac disease. Can I get a test? Is it an easy test?" And or do we kind of test ourselves? We just stay away from gluten for a while and see if the conditions go away.
Yeah, so that's what I would actually encourage people not to do. So the difficult thing the good thing about celiac disease is that you treat it with the diet. The bad thing about it is that if you treat it yourself with a diet and you don't get formally tested, it can be very hard to figure out whether you actually ever had celiac disease later on. And unfortunately, with the popularity of diet, this is something that happens fairly frequently. People just try it out and they go on gluten-free diet for 6 months, and then they come in asking whether they have celiac disease, and that's actually quite difficult to sort out. Because many of the tests we use, even the blood tests for celiac disease, improve on a gluten-free diet. So you really can't tell if they have celiac disease or not. So really, if you have symptoms that are concerning for celiac disease, really the first step is really going and getting a blood test. Going to your doctor saying, "I want the blood test for celiac disease. Test me. It's an easy test. It's just a blood test. It can be done at the same time with any other blood test. It doesn't need to be fasting on an empty stomach or anything like that. And really, I think just more testing for celiac disease is really the best way to get more people diagnosed and get more people on appropriate treatment.
Do you have to find a doctor that's a general practitioner, or can someone just go to their public health department and go in and ask for this blood test?
Most anyone who can order any blood test will be able to order this test, no matter who they are, or what type of physician or health practitioner. We have many people, nurse practitioners, nurses, other doctors besides general practitioners who are diagnosing this condition now. Many young women whose only practitioner is their gynecologist are actually getting tested through them. So really, almost every physician should be aware of celiac disease at this stage and be able to figure out how to which blood test to order.
So if you had celiac disease and didn't know it and never had it in check, and then suddenly you had something else, maybe just a flu, or maybe something more serious like another autoimmune disease that is contagious, would it actually couple it? Will it actually will the two diseases in your body at the same time actually make it worse for you?
Yeah, actually, that's a really good point. So that's actually one of the ways we think that celiac disease turns on in people who are predisposed but haven't yet developed it, is that they get some other GI infection or other infection. It just stimulates the immune system, and then boom, suddenly you have celiac disease. The other thing is that people with celiac disease, when they get one of these things, it's much harder to recover, especially from GI bugs. We often find that people with celiac disease have a much harder time recovering than people without celiac disease. It just is much longer, and they get much sicker from this. It's probably due to overall just the immune system that's not really acting like it's supposed to, not really sort of up to par.
So if a person wants to become part of the study, do they go to their physician or do they call you? How can they volunteer themselves?
Sure. So the best way to go, so this is a study that's ongoing all across North America. The easiest thing to do is just go to the central study website. It's celiactionstudy.com. And that will have lots of information about celiac disease in general, about the study, about which sites and centers are recruiting patients for it, and about what it entails. And I think that would be a good first step. So that's www.celiactionstudy.com.
Celiaction Studies, so it's CELIACTION study.com. It's like the word action and the word celia, the share of the A. There's only one A there, right? Celia. And actually, yep. Robin made it very easy. If you go to WOCA.com and go to the guest list for today, you'll see Dr. Leffler's name on the guest list. And Robin already put the link to celiactionstudy.com on there to make it easy for everybody. And call us if you need that repeated. We don't mind speaking to you on the phone and answering your questions about details that we've had in these interviews. Well, good stuff. It looks like, I've often wondered about this whole gluten thing. Like I've often thought, well, I can eat anything,
Yeah.
But maybe I'm wrong. I mean, I don't feel like I have anything happening. I don't know if I got a rash on my arm right now. Should I worry about I don't know. I mean, sometimes you hear things. I'm not paranoid, typically, but does it develop as we get older?
It can develop at any age.
Yeah, I think you mentioned that.
People develop it in their 90s, so it's unfortunately you're never quite off the hook.
And where are you right
again,
now?
If you really, if people are really feeling fine, there's probably
nothing to worry about.
Probably no reason to run out and get tested.
Doctor, where are you? Where are you calling from?
So I'm calling from Boston.
Boston.
I practice at Beth Israel Deaconess Medical Center in Boston.
Okay. Well, thank you for taking time out of your day today to tell us about this. I guess right now, if somebody were to ask me what is celiac disease, I'd be better prepared to answer them, although I'd still be, I'd say, you know what, go to the website.
Yeah.
I think that's the best thing to do. One of the cool things about this day and age is that you can do that. I mean, once upon a time, you'd say, I don't know, go to the library. You have to look it up, so. Now you can just take your phone out and look it up. Dr. Daniel A. Leffler, good information. Thank you for sharing it. And I'm sure somebody out there was taking notes, and you've probably helped them or helped a family member.
It's a pleasure.
Good interview. We will take a little break, and we'll be right back.
Hi, I'm Leah Caruso with Strive Rehabilitation, inviting you to join me Thursday at 11 a.m. for Health Matters. Ocala Health and Strive have teamed up to bring you the latest information on good health services available to you right here at home. This vital information will help you make informed decisions about your health. So don't forget to join me here at 11 a.m. Thursday. It's news you can use from Ocala Health, Strive, and your friends here at WOCA.
Yes, George. George, you're all wet.
I went to Devon Self-Storage and put back my feet.